Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back to the program Dr. Todd Bezak.
Thank you.
From Chesapeake.
Good to be back.
I'm glad to have you back. And this time, we're going to go into the procedure room to watch an actual eye procedure.
That's
so
correct.
It's very exciting. It's the LASIK procedure, which is laser in situ keratomileusis.
Very good.
Is that close
Very
enough?
Very good. That's an acronym for LASIK.
Now I know why we say LASIK.
Right.
Now you're from Chesapeake Eye Center, and you have offices here in Salisbury and in Berlin.
That's correct.
And you actually do the procedure in the office these days.
I do. We just built a new surgery center about 2 years ago, and we're doing the LASIK right there.
That's very convenient.
It is. It is. It saves a trip across the bridge for many patients.
Well, I'm curious to know what's new in LASIK. I had it years ago, back in 2000, when it was fairly new, and I know you said there's been some upgrades to the procedure since.
There really has. So, and I'm like you, I'm a former LASIK patient. I had it about 15 years ago myself. LASIK is a procedure that is built to reshape the size of the eye and the shape of the cornea. And we do that by creating a flap in the very front section of the eye. The part that has changed is how we create that flap. In the past, we had used a metal blade to create a horizontal incision. And now, through the magic of technology, we're using lasers to create that, which allow us to use a much more precise fashion of creating that flap.
Now, you said it's for nearsightedness, farsightedness, and it even can
and
work.
Astigmatism, and anybody who has a combination of those 2 to 3 different problems.
Briefly tell us about the difference between like normal vision and how the eye works, and then what happens when someone is nearsighted or farsighted, and how
Sure.
this procedure works to correct that.
Yeah, so I actually brought along some charting here, that a little map of the eye, if you will, the anatomy, that shows you kind of what the eye is doing. I like to think of the eye like a camera. So you have images on the outside of the eye that get accepted by the lenses, and there's 2 lenses in the eye. There's the cornea, and then there is the human lens. And these 2 lenses focus images onto the back part of the eye, known as the retina, or the film of the camera, if you will. So this is an eye that is the right length, is the right size to project a perfect image. So this would be a person who does not need glasses, where images are focused directly on the back of the eye or the retina. So we move forward here. Now we have a nearsighted eye, and you can see that these images are now, instead of being focused far on the back of the eye, they're focused in front of the retina. So this is a nearsighted person.
They can see near.
They can see
can't
near.
see far.
So if this patient did not have LASIK or any sort of surgery, they would need a lens in front of the eye to help diverge these light images to reach the back of the eye. That's what nearsightedness is. Now we have farsightedness. This is an eye that I like to think of as that's a little bit too short. So the lenses in the front of the eye that we referred to earlier are not able to get that image focused on the back of the eye, and in fact it's being focused somewhere behind the eye. So you need an extra lens in front to focus those light images sooner. So kind of just the opposite. Lastly, we have astigmatism, which can occur with nearsightedness, it can occur with farsightedness. And what astigmatism is, and I'm going to put this down for a second, it's an abnormal shape to the very front of the eye, and I'm going to access my model here. The cornea is right here, and in a perfect world, in a perfect eye, it's nice and round like a baseball or a basketball. And someone who has astigmatism, it's shaped more like a football. It's a little bit more oval in one direction, and that can occur in the horizontal meridian, the vertical meridian, or anywhere in between. So the beauty of LASIK, and this has been a long-term benefit of LASIK, is that we can treat not only that astigmatism, but nearsighted and farsighted, all in the same procedure.
That's excellent. I guess you achieve that by cutting,
reshape the cornea.
Yeah, reshaping the cornea so we reflect it differently.
Refract
it, I guess that's the word.
We have found that if we reshape the cornea from within, so you refer to the term LASIK, the laser in situ keratomileusis. If we reshape it from within, the eye heals much faster, and there's less or little pain at all for the procedure. And depending on what your problem is, nearsighted or farsightedness, we either are flattening out the cornea a little bit more or creating a more steeper angle for that cornea to focus those images perfectly on the back of the eye.
And this is appropriate for anyone with glasses or contacts, as long as they meet certain criteria.
Right.
You do an evaluation first.
Absolutely. We do. Everyone gets a full evaluation. In fact, often my patients get 2 evaluations because I like to think of myself like a carpenter in some regards. I like to measure twice and cut once, so to speak. But as long as the eye is for the most part healthy, and meaning free of pathology or disease, I don't think of nearsighted and farsightedness as disease. I just think of them as an anatomical change of the eye. But as long as you're free of disease, and anyone with those problems is potentially a candidate, as long as you're within certain parameters. You know, you can go up to 12 diopters of nearsightedness, and I bring up that number. Sometimes people who wear contacts, they look at their box and it says -2 or -3 or -4. So -12 is a really big number. We can pretty much treat anybody that has almost any degree of nearsightedness. They're way, way out there. So almost anyone is a candidate.
And is there an age at which you have to reach, your eyes are done evolving, so to speak?
That's a great question. So the minimum age that I will operate on anyone is about 21 years old, with the caveat that the prescription in their glasses or contacts has not changed much in the last 1 to 2 years. We don't want to operate on an eye that's in flux, that's still, you know, as we grow up, our eye grows longer as well. So we want to see that the eye's reached a steady state, so we only need to do the procedure 1 time. If the eye is still growing, there's the potential that you would need a retreatment later in life.
Right, and what about the other end of the age? Is there an age where you say it's no longer appropriate to do it?
Actually, yes. So there's other changes the eye goes through over the course of a lifetime. The most common is a cataract. And a cataract happens to every single person if you live a nice long life. A cataract is the lens on the inside of the eye that we were referencing a little while ago.
You say the human lens? Is that what you called that?
The human lens. So I'm going to turn the eye sideways here. Again, the front of the eye is the cornea. That's what we're talking about with LASIK. But back inside the eye, back behind the iris, we have the human lens. And this is crystal clear when we're born, and over the course of a lifetime, from exposure to the sun, it becomes cloudy. And when it becomes cloudy, it's called a cataract. B, it prevents you from seeing your best. And C, it would prevent you from having LASIK. That'd be a contraindication having LASIK.
Okay.
So for some people that occurs maybe in their 50s, for most occurs in their 60s or 70s.
So generally speaking, most of the people that get this procedure are in their 20s, 30s?
20s, 30s, and 40s,
Yeah.
generally. There are occasionally some patients in their 50s that I will treat. But I always think the biggest benefit comes to those who get it when they are young. You know, sometime in that 20s to 30s. We were speaking off camera before the show started, and once we reach age 40, there's some other changes in the eye that happen that prevent us from seeing things up close. I like to coach potential patients into having LASIK before that time so they can get the full benefit of being out of glasses. So they can see distance clearly and they can see near very clearly as well.
And what's the fancy word for that?
Presbyopia.
Or you call it the 40-year-old
The
eye
40-year-old
in
eye.
your 40s or whatever,
Right.
Where you need the reading glasses.
It happens to all of us.
I know. When I had mine done, they undercorrected one eye, and it kept me out of reading glasses about 4 or 5 years, I think.
And that's a very common practice for LASIK surgeons, is to leave one eye a little bit undercorrected in a nearsighted patient like you were, so that you do get some near vision for a few extra years, especially as you can check your watch or your phone, you can read something quickly. So I find that as a big benefit for people. It doesn't totally handcuff them to only distance vision.
Now, this is a procedure that isn't covered by insurance. People have to pay for it,
That's
out of
correct.
their own pocket.
It's been a long time since I've seen an insurance company cover it, so it is an out-of-pocket cost.
I guess because it's sort of considered cosmetic surgery.
It is. Insurance companies, their view on the issue is, well, you can wear glasses, you can wear contact lenses, and that's sort of their idea of how these problems can be addressed.
Well, I guess if you're young enough, you could do a calculation of the money you would save over time
Absolutely.
from purchasing
It's
contact lenses.
certainly
and
cost
so on.
efficient to have the procedure done. Plus, it just makes your life that much easier. You wake up each morning able to see the clock function without reaching for glasses, without sticking a contact lens in your eye every day.
Go to the beach. That's
Go
what
to
I
the-
liked about it.
Yeah,
I didn't have
absolutely.
to worry about glasses at the beach, and because I couldn't wear my contacts.
Right. Yeah. Instead, you can
So-
get into great sunglasses.
I know it's just a fabulous a change in a life, for someone that's used to wearing glasses or contacts every day. Now, we're going to go into the procedure room. So before we do that, just kind of give us an overview of what we're going to see. And you're saying there's a separate visit ahead of time, or two visits in your case of patients, where you do a thorough evaluation to kind of map out the eye and what you
Right.
need to do.
And we're doing, in those, the reason sometimes for two visits is I'm doing multiple measurements of the eye. And I like to make sure that those measurements are matching up. Patients that wear contact lenses, even though a contact lens generally is soft, most of my patients wear soft contact lenses, they can abnormally compress that cornea. I like to think of the cornea like a sponge. And if you had a sponge and you laid a saucer on it for a year, and you pick that saucer up, that sponge would be shaped like a saucer. So I ask my patients to get out of their contacts for a few weeks before surgery, because I want that sponge to find its natural state. I want to laser and do the treatment in its natural state, because that's what we're going to be left with afterwards. So that's why it's important for me to do maybe an extra exam.
And then you're going to show us a procedure, which takes approximately how long from start to finish?
In total, it takes around 10 minutes.
10 minutes.
Right. So there are essentially two major parts to the procedure. Like we talked about earlier, we have found that it's a very effective way of treating the cornea by doing it within. So we like to create a partial flap in that cornea. In the past, we've done it with metal blades, which seems a little archaic. That's the way you and I had it done. And the great majority of people did very well with it. But the people that could have it that way it was a smaller subset of the population. Your cornea had to reach a certain thickness in order to pass that metal blade, because it wasn't as exact. That's the thing that we ophthalmologists love about lasers. They're extremely exact. If I ask it to laser a micron, it will laser a micron every time. My hands aren't that good. They're not at laser level. So that's what this newer technology brings, is that we can create that flap with a laser. The second part of LASIK has always used a laser. As you mentioned, LASIK stands for laser in situ. So we use a laser to either lessen the steepening of that cornea. In a nearsighted person, it's a little bit too steep. In a farsighted person, it's a little too flat. So we can adjust that with that second laser. That's a technology that's been around now for 25 years. But this newer technology in the last couple of years, where we can get inside that that front layer with a laser, is brand new. That's why I'm so excited about it.
It is very exciting. So how about we take a look?
Sounds great. So here we have the flap creation laser about to dock to the eye. So I put a suction ring on the cornea that puts a little pressure on the eye. And then with that suction ring, I'm able to guide the eye around and get it exactly to the right treatment portion on the laser. Now the laser actually has a little lens on the front part of it, and we can see that it's docking up to that laser right now. And you can see that the eyeball actually clears as that lens touches it. So now the technician and myself are going over some last-minute calculations to optimize the flap that we're about to create. The beauty of the laser creating this flap is that it's at a very exact depth. And that depth, we're laying down a bubble layer. This laser actually produces tiny bubbles in a sinusoidal serpentine pattern across the cornea. I think of it as a three-dimensional perforation. So many bubbles placed within a very short distance from one another. Now what that does is it allows me later to go to the treatment laser to open that flap, and I break all those tiny perforations with an instrument. Okay, so now we've moved over to the treatment laser, and we can see that the the laser that created the flap is showing a circular pattern there. And I'm using an instrument to start that perforation process, where I'm breaking those tiny perforations to lift this flap up off the underlying corneal bed. This is the quote-unquote coat hanger instrument. It's helping me break those perforations. Once the perforations are fully separated, I'm able to open that flap. And as you can see, the flap is created about 90% across, so a little hinge is left. And that's so that the flap can seat back down and hopefully never become misplaced. Now we're drying the underlying corneal bed so that the treatment laser works optimally, so that the laser is working on the human tissue, not on tears or any sort of hydration issue. And we're getting ready to do the treatment here. There's not a lot to see on the treatment laser, although the laser is a very short process. In this case, it's probably about 20 seconds. Right now, you can see some pulsations in the very center part of the eye, the pupil there. It almost appears like a little smoke is coming off of the eye, and that is the actual evaporation of the tissue. We're actually getting rid of that tissue, like we talked about. We're making the cornea, instead of steep, we're flattening it out a little bit. That's a very calculated amount based upon the patient's prescription. Now the treatment is over. We're going to hydrate that underlying bed with some saline or some sterile salt water and lay that flap back into the spot that it was before. The other thing I really like about this laser is that it's not just simply a flap. You've heard me say the word flap, but it's not that. It's actually cut like a manhole cover. So the edges of it actually go downward before it goes across, which is really nice because now that flap will fit back in like a puzzle piece, and it's less likely to move. LASIK surgeons, one concern we always have is we want the flap to be exactly where we put it. Now I am just making sure it's in position, and then I like to watch it for about a minute before I remove the instrumentation that's keeping the eye open. Over the course of that minute, there's osmotic forces that are actually helping that flap start to seal back down right away. And that seal becomes stronger and stronger with each passing day. But it's relatively strong on day one.
That is really fascinating. I know I had it done myself, but to just see it now being done.
Now you see it from the other side of the lens.
From the other side. And that flap just goes back and fits like a puzzle piece.
That's
because
the way
it's cut so precisely?
Right, it's just like a jigsaw puzzle. It just lays right back in there. And that's one of the advantages by using the laser to create that flap. The old procedure just simply created a horizontal flap that laid back down like this. So it was definitely more possible that it could shift out of place. And that's one of the things we watch very closely in the post-operative period.
Now, in addition to that laser, there's a metal instrument that's like putting in some perforations, and this doesn't hurt at all, correct? You put some anesthetic drops?
We give every patient multiple rounds of anesthetic drops so they're not feeling any pain throughout the procedure. There are certain portions where you will feel pressure on the eye. And I'd like to warn my patients that is coming. Very rarely does a patient complain that it was too much pressure. But I think just the knowledge of those parts of the procedure are coming up helps patients. Now, you mentioned the instrument. We obviously can't have you blink during surgery. We want to laser the cornea, the areas of interest, not your eyelid. So we have an instrument that goes between the eyelids. It sort of looks like a fancy...
It's called a speculum.
It's called a speculum. It looks like a paper clip, goes between the eyelids and just keeps you from blinking for those few minutes of the procedure. It does not hurt. It does feel tight. Like we talked about, I had LASIK done myself. I'm going to be totally honest with you. I didn't like that part. And it wasn't because it hurt. For me, it was a mental issue, something you can blink anytime you want in your life, right? But for those few minutes, you just can't.
But we chatted, there's drugs for this, right? You can give people a little bit of medicine, take the edge off. I
offer all my patients a Valium that they can take, 30 to 60 minutes before the procedure. That makes them just feel a little bit more relaxed. And the great majority of my patients do take it. I encourage them to take it. And it doesn't put them in a state where they can't follow directions. They certainly can follow directions, but Everything's just a little easier.
Right. I mean, I recall that too. Being a nurse, of course, I was ready to do it and have enjoyed the results. But you're right; it's a lot of going ons right in your face.
People are
so
very protective of their eyes. That's the way
Yep.
we were built. That's the way we've evolved. We want to protect our eyes. So I understand that it's difficult, and it's a big moment. It's a big day for every patient, and we do everything possible to keep them comfortable during it.
Yeah, I remember it not being bad at all. And of course, is it 10 minutes total? So about 5 minutes per eye?
About 5 minutes per eye.
That's
From
amazing.
the time you lay down to the time you sit up, it's about 10 minutes. And that's 4 mini procedures like we talked about. There's 2 mini procedures on each eye. So it's very, very short.
Now, what about post-op recovery, or what's involved for the person after the procedure?
The beauty of LASIK and the recovery is that it's very, very fast. I tell my patients to go home and take a nap, and when they wake up from that nap, they generally are seeing much better. When they wake up the next morning, they're seeing much better again. In fact, I expect 95% of the healing, the visual healing process, to occur in 24 hours. So when they come back, and I see all my patients on day 1, when they come back on day 1, I expect them to go way down the chart, if not all the way to the bottom.
I know it's amazing. I don't know how your experience was, but I went home and took a nap for about 3 hours. I woke up, I went to a Shorebirds game, and I could read every billboard out in the outfield, and I was like, couldn't believe it. It's just amazing.
That's a fantastic story. My story is I went home and took a nap, and I opened my eyes, and I looked out the window, and there was a tree outside my house, and I could see the leaves. And I said to my wife, I didn't know that we could see the leaves. I didn't know that was possible. So it affects and everyone kind of remembers those first moments when they saw much more clearly.
Yeah, when you can't see well for years, it's really astounding. Now, you do have to put some drops in for a few weeks, antibiotic, and
you do, so to protect against an infection. And a possible complication is an infection, and they're very, very rare. First of all, the complication rate for LASIK is much less than 1%. So it's a very, very successful surgery. But one of the things that we protect against in any eye surgery, and LASIK is no exception, is potential for an infection. So you're taking an antibiotic, you're taking it 3 to 4 times per day, and it's an eye drop. You're also taking some steroid eye drops to help decrease the inflammation and to encourage healing. And lastly, we have you taking artificial tears. The eye tends to get very dry in the post-operative period, and for that reason, we have you re-wetting the eye as often as possible.
And about how long might you need to take the artificial tears? I know some people can have dryness that
So some folks do
get
it's the most common side effect is dry eye. Some people are taking it for months and months afterwards. Some people take artificial tears forever afterwards. And my patients know this going in, that potentially they may have to take them. And if they're willing to accept the fact that that's a small price to pay to have great vision, then I think that makes them a realistic consumer and patient.
So, and they do have to wear an eye shield for how long?
Right.
So when they sleep at night, they don't inadvertently rub? Or...
That's exactly right. So we talked about the flap and how important the positioning of that flap is. And the biggest obstacle is sometimes ourselves. When we are sleeping, our eyes may feel irritated. We may have the tendency to want to throw a knuckle in there. And as your eye surgeon, that's the last thing I want. So for that reason, I have everybody sleep in goggles for about a week. I ask for a week. Sometimes people wear them longer if they want to, and that just kind of protects you from you.
So very successful. People can get to 20/20 vision, or
20/20 or beyond. I also want to. Not that I like talking about complications or side effects, but the most realistic, other than the dry eye, would be an undercorrection or an overcorrection. So we apply a certain amount of laser based upon your prescription. And some patients, it's under 5%, sometimes we'll need an additional laser to achieve that perfect vision. 95% of the treatment was done, it just needs a little touch-up. Sometimes you'll hear people talk about a touch-up. It is rare, but the larger prescriptions, people who come in with a big prescription, have a higher chance of potentially needing a touch-up. The beauty of it is that the touch-up is very easy. The patient is usually very aware and keen to what the process is, and just takes even less time than the primary procedure.
Now, this is one of those procedures too, where you pay a set rate to have both eyes corrected, but that also includes visits for a year after. You have to come back, have follow-up visits, test your vision, and so on.
Correct. So our fees include everything for the first year, and then not only does that include the evaluation beforehand, the treatment. We see you on day 1, week 1, month 1, 3 months, 6 months, and then finally at a year. Generally, kind of as we're coming up to that year, we're making our full assessment of where the vision is. And like we said, in the great majority of the time, patients are very happy, doctors very happy, and you live the rest of your life, or at least until you get cataract, with very clear vision.
And you need those reading glasses still.
Right.
So if someone's interested in the procedure, they can contact your office and set up an evaluation. Is the evaluation free, or that's involved in the if
So
you
there's
have
a
the procedure
screening.
done?
When a patient calls, we have a screening process to save you the first visit. Because some patients call in, they don't know if they're a candidate, if they're not, and there's a few obvious things that my screener will pick up on. And if you jump through all those hoops and everything sounds good, we bring you in for an evaluation where we measure your eyes 8 ways from November. And then we talk about if you are a candidate. There is a fee for that evaluation process, and that's around $200.
Okay.
That does get applied to your surgery if you then go forward with the procedure.
Yeah, that's what I thought.
Yeah.
So, I mean, this just sounds like a wonderful way to correct your vision. You know, you do have to pay some money up front, but in the long run, and then of course the convenience of not having to deal with contacts and glasses, it's just phenomenal.
It really is.
Now, Todd, one last thing. If someone was evaluated previously and deemed not a candidate for the previous type of LASIK procedure, could they possibly have this procedure now, be eligible for it?
I'm so glad you brought that up, because with the previous procedure, the way you and I had it with a blade creating that flap, we were very limited as to how deep into the cornea we could go with that horizontal flap, and it had to be actually fairly deep. That's the technology at that point. The new procedure, with using a femto laser, we can do a much thinner flap. So the reason that's important is people that were maybe denied surgery because their corneas were too thin may now be back in play for this newer type of procedure. And I've already encompassed a few patients in my practice that would not have passed previously. So that's a really exciting portion of the new procedure. Is a whole new subset of nearsighted and farsighted people can benefit from it.
And you called it a femto laser. I know I had Dr. Smoot on previously, and she talked about that very same laser with the cataract procedure. So
right.
It sounds like we're benefiting in many ways.
Absolutely. The femto started with this with the LASIK procedure, and now we've developed and utilized it in cataract surgery as well. So it's been a great advancement in our field.
Well, it's all very exciting, ways to enhance vision. It's just wonderful. And thank you so much for being on the program.
Thanks for having me back.
Joining me in the studio is Peter Mace. Welcome, and thank you for coming on.
Of course.
You nicely enough consented to be the patient in the LASIK procedure with Dr. Bizak. And so you also said you would come in and do a short interview about your experience getting this surgery. So let's start out with, why you decided to have the surgery.
Well, I've never really had good eyes. In 6th grade, I had to start wearing glasses. By 8th grade, I switched over to contacts. And then my eyesight kind of settled once I got to college. So it settled down for about 4 years. Then my regular eye doctor recommended I could get eye surgery. I wore contacts. I was pretty comfortable with that. And sure enough, yeah, went to the LASIK Eye Center. They, ran a couple tests, proved that I was a potential candidate, and then, yeah, within a couple months, I got the procedure. It's easy enough, and now I'm here today.
So, Peter, how old are you, and is this the time when the doctors recommended that you be a candidate for this procedure and get it done?
Well, that was actually one of my first questions, because my dad got it, and obviously he's about 60 by now. But I'm only 24 years old. I thought that was too young. I know they want your eyes to kind of remain steady, which mine have. So my eyesight's been stable for about 4 years. So apparently that made me a potential candidate. And actually being 24 years old made it an even better candidate because I could recover quicker. I'm a little bit younger, a little bit healthier. So they said that was perfect for them.
Right, I think it's a matter of your eyes being done changing, because my son had the procedure and he was 21 at the time, but he had been under their care for years and his eyes had stabilized. Because I know Dr. Bizak mentioned that this is a prime age to get it done. Young adults who don't want to fuss with the contacts and their eyes are done changing.
Yeah, it's been perfect.
So tell us about the procedure, how it was to experience that.
Well, I was actually surprised at how simple it was. Going into it, before I did any research or anything. I thought, I'd have to wear like eye patches for a week or something. But prior to the procedure, you don't really have to do anything. Like I said, they run a couple tests. I had to wear glasses for a couple weeks before then so that my corneas would settle and, so they could take appropriate measurements. But those were very simple. They weren't any different than, your routine school eye exam. And then they did measure twice. And then the actual procedure, I showed up that day. It took about 15 minutes from when I walked in and when I walked out, and that was it. So it was
Were you
simple.
nervous about it, or did you require the pre-procedure Valium to settle you down? Because some people get freaked out about having their eyes worked on.
Yeah, that would be, it certainly wasn't painful, but I would just, describe it as weird. But I've had lots of friends that have had the procedures, and they all seem, told me the same thing. Nobody had any crazy stories or anything. So my dad had the procedure. Like I said, lots of friends of mine that were about the same age as me had the same procedure. But yeah, I took a Valium beforehand, but I think you could have gone without that even. It wasn't too stressful. Just kind of weird.
I know to have somebody like working on your eyes and you got the laser going. I know I had it back in 1999 or 2000, but great vision since. And how's your vision?
Perfect. Yeah, better than when I was born. It's pretty amazing. I can't believe how well I can see. Better than when I had contacts, better than when I had glasses.
And I know they usually recommend you go home and take a nap, sleep for a few hours, and then wake up. And did you notice a change in your vision at that point?
So yeah, just like you said, went home, took a nap for an hour or two. By the time I woke up, my vision was, not perfectly clear, but completely different. And then by the next day, it was pretty much perfect. I was still sensitive to light. But all things that were not hindersome or anything. Yeah, it was pretty strange actually.
It is. Just suddenly when you wake up and you can see the clock and see things at a distance. Were you nearsighted or farsighted?
Nearsighted. So yeah, and pretty simple.
And have you had any issues since? Any problems with halos or needing eye drops?
Probably the halos took the longest to go away. So at night, I did notice that sometimes with lights, but even, within the past couple months, even those have settled. And for the first month, maybe a little bit irritable to light, and I'm still kind of that, I find myself putting on my sunglasses a little bit earlier, but nothing that's hindersome to my life or anything. No dryness either. I haven't really noticed anything different from that. I've never really had a problem with dryness before, so.
And you're about 3 months out.
Yeah, about 3 months out.
Well, that's fantastic.
Yeah.
You seem to be having a great recovery.
Yeah, it's been pretty easy.
And great results.
Uh-huh.
So I guess you'd recommend this.
I would recommend it.
Peter, what would you say is the most impactful thing, the change from having this surgery compared to before when you needed glasses and or contacts?
Probably just the convenience, waking up in the morning or traveling, I don't have to deal with anything. Especially, well, for me personally, I grew up next to the beach, so I'm in and out of the ocean all the time. Not to mention I coach soccer, play soccer, very active. So that just makes things a lot more simple. I never have to deal with glasses or contacts or anything like that. It's pretty easy.
And it sounds like you've had a terrific outcome.
I have, yeah. It's worked out pretty well.
Well, thank you. Well, thanks again for being with us and sharing your experience.
Of course. Happy to be here.
And thank you for joining us for this edition of Focus on Health here on PAC 14.